Friday, Emily.
Good morning. The FDA says unapproved lasers are risky because they can cause permanent eye injuries. At the same time, laser surgery is becoming increasingly popular to correct mild vision problems. Doctors use the lasers to correct or improve the eye's focus by permanently changing the shape of the cornea. The FDA approves the surgery to correct nearsightedness or astigmatism using a process called photorefractive keratectomy, or PRK. Look closely at this tape. You'll see a red light on the patient's eye. That's the laser doing its work by delivering bursts of ultraviolet light which vaporize precisely targeted corneal tissue and correct the patient's vision problem. Only lasers manufactured by Summit Technology of Waltham, Massachusetts, and Vizix of Santa Clara, California, have been approved by the FDA for use in this type of eye surgery. Both of these companies participated in clinical trials supervised by the FDA for nearly a decade to demonstrate their lasers could effectively correct nearsightedness and astigmatism.
I think a lot of people will be surprised to learn that doctors are using lasers that aren't approved. How would you know, if you're going in for this surgery, whether or not your doctor's laser is approved?
And that's just what the FDA wants you to do. They want you to ask. They want you to ask the doctor if he uses one of two types of lasers. One is by Vizix. Any laser made by Vizix of Santa Clara, California is approved and fine, and the Summit Apex brand is approved and okay for use. Doctors also receive training to use these lasers, so that's also very important, but you have to ask to know if it's one of the approved brands.
Yeah, because we would just assume that if a doctor is getting ready to perform this kind of surgery, that certainly the laser machine would be approved. That makes a lot of people kind of think, well, maybe I should just stick to the contact lens or the glasses. What's your opinion of this surgery?
Well, I think if you're really interested in having this surgery and you really want to correct a bad vision problem, it's okay to go ahead and have it done, but you have to be a smart consumer. You have to ask the doctor if he's using an approved laser.
What are the risks?
Well, as with any surgery, there's potential risks, and you have to talk to your doctor about that. Don't make a decision without having a good conversation about risks.
Good. I'm glad to know this. I'm thinking about it. Okay. Thanks, Emily.